Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're going to learn about how to keep your eyes healthy and what happens when things aren't so clear. And that's a little bit of a pun because eyes, frequently that is what we notice first, that our vision is not so clear. But my guest today is Dr. Daniel LaRoche. He's the Director of Glaucoma Services and President of Advanced Eye Care of New York. He's affiliated with the New York Eye and Ear Infirmary and Assistant Professor of Ophthalmology at the Mount Sinai School of Medicine here in New York. Dr. LaRoche, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you for having me. It's a pleasure to be here.
Everybody always wants to know because your field is very different. I think it's very different. It's almost like something people don't think about unless they need you. But how did you pick this field of ophthalmology when you were starting to decide where you wanted to reach out to the community and be a healthcare provider of sorts?
I didn't really know about ophthalmology until very late in my medical school career. I had done different rotations in surgery, medicine, psychiatry, and ophthalmology was one of the last rotations that I did. And what I found fascinating about that is that when you look inside the eye, you can actually see disease pathology. Like you can see the effects of hypertension, diabetes, glaucoma. You can actually see the pathology that's going on inside the eye and affecting the rest of the body. That was one. Two, it was a nice mix of seeing patients in your office for eye examinations and being able to do surgery and going to the operating to be able to operate to restore vision from cataracts, lower the eye pressure, do glaucoma surgery to preserve and restore vision. So that was a nice balance of seeing patients in the office and doing surgery versus just being a surgeon most of the time being in the operating room all the time. And so you had that nice mix. And then third, I learned that glaucoma was a leading cause of blindness in the African American community. And I was struck by that, learning about those statistics. And so that led me to enter that specialty of glaucoma to try to find out why that is. And there was a shortage of practitioners in the African American community to help treat glaucoma patients. I wanted to learn more about that and see what we could do to advance that science.
Wow, that's so impressionable. I mean, we work with high schoolers and sometimes they have a list of things they want to be, but yours was actually the perfect progression because you had gone through the other body systems and then you found them again in the eye, which I think is very interesting. So with the basics, what really should be the schedule for a first eye exam? Is it when something's wrong, or is it a certain age? You go to your primary, he says, it's time for an eye exam. What would you suggest? Yeah.
We're very lucky in the United States. A lot of schools have eye screening programs. So they will screen the kids and check their vision. And so a lot of the schools will be that front line. But for from parents at home, when you have children, you want to make sure that their eyes are straight and equal and they move together synchronously. And when you look inside the eye, usually you see a red reflex. That's normal. Sometimes you see a white reflex. A white reflex could be a sign of cancer, retinoblastoma. It's pretty rare. But if you see something abnormal, follow your gut instinct. And if you see something you suspect is not quite right, follow your gut instinct and take the child in to get eye examination. Now, some children, we are having a myopia epidemic, okay, because kids are looking at their phones all day, they're reading close up all day, they're on technology all day, they're not going outside, they're not getting sunlight, they're not playing out in the playground. So this is leading to a myopia epidemic where the eye grows abnormally long, okay? Because it's not getting a healthy amount of sunlight and distance vision. And then what happens, you get retinal thinning that can lead to retinal degeneration, myopic degeneration, retinal detachment, increased risk of these things happening. So it's very important that parents tell their kids to take a break from looking at the close-up technology, spend some time outdoors, 1 hour a day doing some outdoors activities, playing activity, running around. That'll help reduce the incidence of myopia. And as we get older, the lens in the eye doesn't focus as well. Okay, the lens gets harder, our hair gets gray, the lens gets a little harder, it doesn't focus as well. And then you start to need reading glasses. That's usually around age 40 years of age. And so when you get close to 40 years of age, if you notice you can't see things as well close up for reading for the computer, that's probably because you're developing presbyopia and you may need some reading glasses. So that's another good point to make sure that, you get your eyes checked as well. And then when you get closer to 50, because the lens increases in size as much as 30% with age, that can contribute to elevation in the eye pressure. If you touch your eye, the eye has a mean normal eye pressure of around 15. When you get to a pressure about 18 or higher, that can lead to damage of the optic nerve and glaucoma. That's usually caused by an enlarging lens in the eye as a major cause. There's other secondary causes. It's less, numerous diseases that can cause that. And so if that's the case, then you want to be monitored and evaluated for cataracts, glaucoma, possible early cataract surgery to help prevent glaucoma. And in the 60s, cataracts can get worse. And when you get into the 60s and 70s, you get macular degeneration, which is degeneration of the macula and the retina in the eye. And then you want to get checked for that because we do have treatments that for all these diseases, we have treatments that can help restore vision and prevent vision loss.
What are some of the questions? You sound like someone that's very comfortable with what's going on in the community. What are some of the questions that folks ask you most of the time? And I really appreciate you bringing on the parent going with their gut. If their kid's eyes are not right, then they're the ones that would notice that probably first, because pediatricians only see them scheduled if they have a pediatrician. So what are some of the things you do in the community to make them aware of these things to watch for? I know I've seen a lot of your YouTube videos, and I think those are really helpful because people are, as you said, on the computer too much, but that's where I get a lot of my information. And so what do you think we should, or maybe we should do it as a team, not just you, but how should we aim our information to the community? You mentioned the schools, which I think is absolutely true, but how else can we get this information out about when you notice something's wrong?
The thing that you're doing right now, highlighting eye care on the media, is an important thing to get information out to the community because you're at the Nassau Community College, but all those college students have parents, grandparents, extended family members, and they'll also be more aware. So what you're doing is a great thing. We educate our patients, each of our patients. Like any of my patients that have glaucoma, we educate them, say, hey, make sure you get all your family members checked. Next time you have a family reunion, make sure they all get their eyes checked because there are 3 million people with glaucoma in the United States. 1.5 million, half of them, do not know that they have the glaucoma because it's not a painful disease. It's a silent thief of sight. And so education becomes a big part. We developed a low-cost glaucoma calculator where we can just checking the eye pressure with contact or non-contact device, pachymetry, and the age of the patient, we can calculate someone's risk of glaucoma with 90% accuracy. And so now what we're starting to do, and this is pretty recent, we're offering free glaucoma screenings in our office. And we do that usually on days I'm in the operating room because my staff knows how to do it. We've trained them. Yeah. So they can do it. You don't even need a physician to do this type of a screening. So we're teaching people to educate people like that through articles in the media and things like that. We're educating people. The problem that we're running into, though, right now is this insurance industry issue. We have a very dysfunctional insurance system. Most other, like European countries, Canadian countries, have a universal health care package where everybody has health insurance and can access care. Here, we have privatized healthcare insurance, where these insurance companies are not looking out for patients. They're looking out for their shareholders because they're publicly traded on Wall Street. And that's their fiduciary responsibility. And that creates a conflict because as a doctor, I took an oath to do no harm and take care of my patients. The health insurance industry hasn't taken the oath. They're just looking to make money. And they drop people's health insurance. They deny people care. They deny payments to the hospital, deny payment to the doctors, don't insure people. And so that creates a lot of havoc for patients who are in that flux, can't get access insurance, get dropped by insurance. Insurance doesn't cover certain things. And so that's the problem we're having, is an access to care issue that's affecting Americans and the health care that Americans can get. Because although we're the wealthiest country, we're very low down in terms of the health of America as a nation because of this type of a problem.
We're going to come right back to that because I understand your position and I totally agree with it. So you're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you are learning about how to keep your eyes healthy with Dr. Daniel LaRoche, the Director of Glaucoma Services and President of Advanced Eye Care of New York. He's affiliated with the New York Ear and Eye Infirmary and Assistant Professor of Ophthalmology at the Mount Sinai School of Medicine here in New York. You talked about something that is so true, and I hear it all the time. And in our neighborhood, and I'm sure in yours, we have Costco's now that have eye centers in them, and we have, I think, BJ's. So we're seeing, and some of the pharmacies are starting to have eye screening, or I'm not 100% sure because I still go to a private doctor, but it seems to me that they're trying to attract attention to eye health, just being a service like that, like a grocery store or a drugstore where everybody in the neighborhood goes. Do you agree with that, or?
There's a couple of things. I mean, a lot of the stores like Walmart, BJ's, they're opening up opticals because those are retail establishments, and there's a lot of profitability in opticals. There's a lot of markup on frames, and so there's a profitability component. But sometimes the eye examination in a retail setting is not the type of detailed eye examination that you need. They may be just focused more on checking you for glasses and selling you a pair of glasses, but not looking very carefully at some of, the cataract component, the eye pressure component, dilating and looking at the optic nerve very carefully. Because some of these places, they're seeing a lot of patients in a day, and they're spending just a very little time really looking at the eye and counseling the patient about what they can do to help keep their eyes healthy. I'll give you an example. Diabetes is a big problem in America. 30 million people have diabetes. About another 89 million people have pre-diabetes, with obesity in that respect. And so if I see a patient that has diabetes or at risk for diabetes, in addition to evaluating them and checking their retina and seeing if they need treatment and we can give them that treatment, I'll also spend a great deal of time counseling them about diet, exercise, communicating to the primary care doctor about what's going on with that, so that, they can change their lifestyle to really take control of their health and prevent, amputations of your leg in the future, blindness from retinopathy, kidney failure from diabetic nephropathy, and things of that nature. And so these are detailed conversations that you could have with your doctor, your ophthalmologist, your medical optometrist specialist. And you're not going to have that type of time and detailed conversation in a retail setting very often, is what I find. Because sometimes we'll see these patients that come to me later on, and they've maybe gone to the retail setting, but didn't get this information, and their eyes in the worst condition sometimes because of that.
Well, you know what? Maybe I'm thinking that my thoughts in hearing people that go is that they're comfortable in those settings, so it's like a first step. What could you tell people about what to expect with a first eye exam? Because really, it probably is someone has figured out something's not right with their vision, and they need to reach out to an expert. So they go to what's comfortable for them first, and then maybe they're going to follow up again, and maybe they get your number, say. So how would you explain what the first visit will be like and what it should be like when they go for a pair of glasses or just the exam? Well,
once again, there's different levels, but to get a good evaluation and comprehensive evaluation, an eye doctor will first take a history from you and see what's bothering your eyes and get that history, what's causing you blurred vision. Get asked about your past medical history, your past surgical history, all the surgeries that you've had. Take a list of all your medications. Do you have any allergies in that respect? Do you have a family history of disease, family history of glaucoma or other retinal diseases or things of that nature? Then they'll get into the ocular examination where they'll check your vision, check the movements of your eyes, check your pupils, check your peripheral vision by hands first. Then with a slit lamp device, like you see behind here, which is a magnifier that looks into the eye, examination, the cornea, look at the anterior chamber, look at the iris, check the eye pressure. If your eye pressure is high, then place a lens on the eye and do gonioscopy to look at the drainage angle. And even at that type of a test, half of ophthalmologists don't even fully do. So even at that, you want to get a good ophthalmologist that know how to do those things if needed. And then they'll dilate your eyes, which takes about, anywhere from 10 and 20 minutes to dilate the eyes with eye drops, and take a look at the retina and look at the optic nerve and look at the macula. And if they detect anything that's wrong, they may need to do some additional testing, like a visual field testing, a OCT testing, a photograph to document the picture and then be able to explain to you what's going on. And then if you need some treatment, they would need to treat you or coordinate treatment with a referral to a specialist. Because we have a lot of specialties like retina, glaucoma, uveitis, cornea, that are very specialized depending on what's needed. And then, make a follow-up arrangements. I mean, if you're stable and okay, they may say come back in 1 year. If it's something that's active that needs to be managed, maybe you come back in 3 months or 6 months, depending on what that is. And so this is along the lines of what to expect. And, usually an ophthalmologist will be able to do those type of thorough examinations. Some optometrists will do that type of examination. And you don't really get that as much in a retail setting. So you just have to be cautious about that and make sure, particularly when you get closer to 40 and up, you get a good comprehensive examination.
That makes sense. But it's good for them to, start somewhere and at least get the eye health on their radar so that, because it's usually sparked by something. What happens when a patient comes into you or calls for an appointment and they're really nervous? There's a big change in their vision and they're finally addressing it. How do you, do you have help, not help, but, do you have someone to help take them down off the ceiling saying, this is okay, we're going to start ABC, we're going to do an exam, we're going to ask you some questions. How do you get them to be comfortable with a change in their vision that may or may not be able to be reversed, but that you assure them that you can help them move forward and have quality of life? How do you handle someone like that? I imagine I would be like that if all of a sudden I would be like a wreck going into your office.
Well, it depends. I mean, thank God we have a lot of tools and treatments where we can prevent vision loss and restore vision. But I do have some patients who have come to me too late and they've lost vision and they're near the end of the road in terms of their vision. And there's not much that we can really do. I mean, we're doing some stem cell work and laboratory animals, but that's not ready for human use yet. And it's not proven yet. It's not fully available yet. You have to be careful because some international places will claim they can sell you stem cells to restore vision for $10,000, but it doesn't work and you just waste your money. But in those patients, I do share with them stories, such as people who have lost their vision or didn't have their vision, but still enjoyed life and did great things. Like Ray Charles, okay, who was blind. Okay, like Stevie Wonder, who was blind, okay? And he made great contributions to society and enjoyed life. And then vision is only one of our senses, okay? We have the sense of smell, taste, hearing, touch, and that there are many things that you can do. And I'll say if you can't see, it's not the end of the road. What you can do is really just change your focus on the other senses, listening to music, going to concerts, just changing your perspective, with family members, holding hands together as you're talking, more hugs, things of that nature. So you have to change your focus to really still continue to enjoy life and get the most out of it in that respect. So it doesn't, even going out on a hot sun day, you feel the heat of the sun on you. Okay. You smell the roses. I mean, all those things are going to be heightened senses. You take advantage of and do that. So, it's not the end of the road, but the good news is that nowadays, in many diseases with the eye, we can prevent that blindness. And that's the key thing with early detection, early treatment, education, we can prevent this type of blindness from happening in many people.
Well, you pointed out a good factor, though, that a lot of people don't have access to healthcare, the way they really need it. And you talked about a minority group, African Americans, being at high risk for glaucoma. I mean, it's not the only thing that certain ethnicities are really at risk for and just can't make that step into the healthcare system. When they come to you and they say, I don't know if I can pay for this. I don't know if my insurance covers it. I'm just getting the feeling that doesn't stop you from doing what you have to do. And do you have someone in your office, though, that could help them navigate the healthcare system to try to see if they are eligible for some kind of insurance or anything like that? Is that part of your team?
Yeah, well, we offer a low entry price to come in for people that don't have insurance for the level of things that we do, because healthcare is not free. I mean, there are costs involved with that. We're in a private practice. And then we do give them numbers, because we do take some Medicaid health plans like Metro Plus, Fidelis. And so we'll give them those numbers of patients they can call to take those insurances. New York State, with their Medicaid program, they have these Article 28 facilities called Federally Qualified Healthcare Centers, where they take Medicaid also and pay a premium there, but to people who have those services. But sometimes there's a lot of student doctors or resident doctors there in that respect. So they may not have the experience surgically with some of the techniques that we do in that respect. But, where there's a will, there's a way. We do work with people to try to make it affordable. But, there is definitely costs involved, because we have staff we have to pay, we have rents we have to pay, supplies we have to pay, and the surgical facility have their fees. So all these things, there is some cost involved.
Yeah, but sometimes having that open door where you can come in and talk privately about things that are not working perfectly, give a patient a new hope that we can figure out a way. But there's always plan A, B, and C, You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the Nursing Department here at Nassau Community College. And today, you're learning about how to keep your eyes healthy. Dr. Daniel LaRoche has been doing a wonderful job about talking about the need for eye health to be maintained. And he's also continues to do work on his, outside just this radio show. And he's affiliated with the New York Ear and Eye Infirmary and assistant professor of ophthalmology at Mount Sinai School of Medicine here in New York. So this is really a very informative session. So my question to you, it's a personal question. Okay, so we've talked about a lot of the things, the barriers to eye health and making sure that you have an opportunity for good health. Now, I have age-appropriate cataracts. Is that appropriate to talk to someone and say you have age-appropriate cataracts? What does that mean? Because that's what a lot of my peers are hearing. We all have and I'm like, how old are your cataracts? I said, I don't know, mine are age-appropriate.
One of the things is that when you go to 10 different doctors, you'll get like 10 different opinions, 10 different terminology. And so I don't use the word age-appropriate cataracts. Because to me, generally speaking, cataracts start around age 50 overall. And as your age goes up, the incidence and prevalence of cataract increases with age. And for me, the key thing about cataract and when we're going to take a cataract out is two factors. One is that enlarged lens and cataract causing opacification and blurred vision. Is it interfering with your vision and your activities of daily living? Okay, are you having more difficulty reading, more difficulty driving because of that? That's one. And the second thing is that enlarged lens contributing to elevated eye pressure. Is it causing narrowing of the drainage angle? Is it causing increased pigment liberation in the angle? And I'll look at the angle and I'll check your eye pressure. Like I told you, the mean normal intraocular pressure is around 15. Okay, if when you're 40s your pressure was 15 and now it's all of a sudden going to 18 or higher, that's like a glaucomatous type of pressure, pre-glaucoma pressure. And I'll have a conversation. I'll say, hey, look, your eye pressure is 18 now because of this larger lens. You can be 50, 60, whatever. If you want to help get ahead of glaucoma, now would be a good time to take the cataract out, because then we can help stop this process. And at that same time, also you offer your minor micro-invasive glaucoma surgery to open up the drain a little bit that's been blocked up, that's causing this problem. And that will help to lower your pressure and help offset glaucoma. Now, I have some patients who are 80 years old. They have cataracts. They're seeing almost 20/20, maybe 20/30, 20/40. They have a normal pressure of 14, and I've not touched their cataracts because they're happy. It's not causing a problem. It's not interfering with activity of daily living. The eye pressure is not high enough glaucoma. That's rare, though. That's pretty rare, but that can happen too. I've had some patients who are 40 years old with very high pressures, a really fat, clear lens. They're not visually impaired, but they have this huge fat lens that's, maybe genetic or grown out, and they need to have that lens removed as early as possible to really prevent damages from glaucoma. So it varies with different individuals, and depending on what my findings are, we have that conversation.
I always thought and you talked a little bit about genetics of the African American with the increased glaucoma. I always thought blue eyes, which I have, I had to wear sunglasses, and I can't remember where they are. It doesn't work for me. So is there a connection between the color of the eye and aging or damage to the vision? Are blue eyes really more susceptible? I mean, I really never thought about it until they said, I hope you're wearing eyeglasses and sunglasses. And I said, but I've heard that.
The only thing I've seen, people with brown eyes have a lot more pigmentation in the eye. And that more pigmentation is more release with the enlargement of the lens and more pigment obstruction of the drain. That's an anecdotal observation. There have been some studies that have documented the increased pigmentation present. That's the only real difference that I've seen. The other thing is that the more pigment you have in the eye, that can be a little more protective against cataracts and retinopathy or macular degeneration, particularly in a tropical climate. Like if you're close to the equator, those people with brown eyes will probably be a little more protected against the sunlight compared to blue eyes that may not block the sunlight as much for cataracts and retinopathy or glaucoma.
Well, I think that made me feel better because he says at the same time, I'm like, I'm get grayer and grayer as I go along with the hair. But listen, I really, really appreciated this show, and I want to thank you, Dr. Daniel LaRoche, for being here. You are the Director of Glaucoma Services, and you're the President of Advanced Eye Care of New York. You're still affiliated with the New York Ear and Eye Infirmary and Assistant Professor of Ophthalmology at the Mount Sinai School of Medicine here in New York. We hope you stay safe and continue to stay healthy and to continue to do great work. And if you have anything that you want to leave with the audience, this is the moment to do it.
Okay, well, thank you for having me on your show. Thank you for highlighting eye health. If people want to get in touch with me, because I am in the New York City area, we have an office in Queens Village at 718-217-0424. My website is advancedeyecareny.com. And we also have educational videos on my website and YouTube page, Daniel LaRoche, MD, that talk about eye health, eye disease, and things of that nature for more information.
Thank you so much, Dr. LaRoche. This is Joan Buckley from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.